Hello, everyone. Welcome to Feels Out Loud, brought to you by Becoming Together Therapy and Wellness. This is your host, Becky McNattin. I am so glad to have you listening this morning as we live and share stories of mental health. And today, everybody, we are joined by special guest and therapist, Kristen Schmidt-Shay, which I am really looking forward to. Welcome, Kristen.
Thank you. I'm so excited to be here.
It's great to have you on the show. Now, you're a clinician who has a long background in something called Dialectical Behavioral Therapy, and it's a lot of words, a lot of letters, and although you practice a bunch of different modalities, this is an area of special training for you.
It is, yes.
And we wanted to share more with listeners all through the episode today about this type of therapy. So as we get started, tell us about you, Kristen.
Well, yes, I've been practicing clinically for over 25 years, and I've been practicing DBT specifically since 2001, so a really long time.
A long time.
And in a lot of different ways. So this is a therapy that I was originally trained in, in 2001, right after graduate school, because I was working with a group of people at the time who were very hard to treat, very, very difficult, fairly significant mental health issues.
Okay.
And this was a therapy that was known to be helpful or thought to be helpful at the time. So I was trained in it as a way to treat people who have significant self-injury, suicide ideation, things like that.
Okay.
And then through the years, it's been used more and more to treat all different kinds of disorders.
Yeah. What you're bringing up is about 20 years ago, It was kind of a newish modality.
It really was.
That was used with a specific demographic or in an arena that was researched, and so people learned it and trained in it because of that. And then it sort of exploded into application, which we do a lot in our line of work. Therapies are maybe created with a specific idea in mind or a diagnosis in mind, and then they become adapted to a whole wide range of things. Which is part of why we want to talk about it today, because DBT is a widely used therapeutic strategy. So what makes you passionate about it?
Well, it's interesting. I actually did a group this morning with a group of clients,
a
DBT group, and I told them I was going to be on this podcast and what they would want people to know about it. And so,
great question.
Yeah. And so I got some really great feedback from some of my clients. These are people that generally have done DBT for quite a while.
Okay.
And I'm doing kind of an aftercare group. So these are clients who've used DBT in multiple areas of their life, usually for many years. And a lot of them told me that one specifically said the world would be a better place if everyone knew a little bit about DBT. And he specifically said, especially, in this climate that we're in right now in the world, he thought that everybody would just be doing a little bit better at interacting with other people and being able to kind of cope with their own emotions if they knew some of these skills. I hear that a lot.
What a good
people.
point. Well, yes, and we're going to get into this through the show today. But part of what that person is referencing is the essence of DBT is kind of checking in with what's going on with me.
Right.
And from this space of high emotionality, taking stock of what's going on, and then perhaps using some tools on regulating ourselves.
Yes.
So we aren't only making decisions from that space of big feel.
Exactly.
And you think about how many things would be different if we did that more often.
Right.
I know somebody super well who said that they wished every child had to take a dialectical behavioral therapy class in middle school or high school. And what would be different about adults who emerge into this world if they had a foundational level of awareness of the way that emotions show up in their day, in their decision making, in their relationships, even in their awareness of self, and then responding differently about that if we started it even super young. So I totally agree with your client. Super interesting topic here. Right now, we're going to take a short commercial break, everybody, but stay tuned as we further explore dialectical behavioral therapy, otherwise known as DBT. Thanks for listening to Feels Out Loud. We will be back in just a moment. Express yourself. In a world full of strangers, you don't know who to trust. All you see is
you've lost. You can't go it alone.
Welcome back to Feels Out Loud, brought to you by Becoming Together Therapy and Wellness. I am Becky McNattin. I want to dive right back into the discussion we've been having on DBT. And Kristen, you said that you've been practicing DBT for many years,
yes.
A couple decades now.
It's been a long time.
Yeah, what would you say are the main components of this approach?
Well, it's interesting. This approach is used in a couple different ways. There's a really adherent evidence-based DBT, which has been researched and is used with people who generally have fairly significant mental health issues and who need a higher level of care. And in this way, DBT is practiced with a weekly skills group where they are taught different skills by some therapists, two therapists who are trained in DBT. And then there's also individual DBT therapy, which
as a part of that process.
A part of this process. Okay. And then the therapist also attends a consultation team meeting once a week where the therapist gets like therapy for the therapist, essentially.
Wow.
And because it's considered such a difficult to treat population usually, and just people who have some very significant issues. So that is a traditional DBT. That is adherent-based. It's how it's been researched.
And so someone would attend a group and they'd attend individual therapy with one of the people who does the group too.
Usually one of the people that does the group. It can be a different person, but it has to be a DBT-trained therapist.
Okay.
And the therapy is done in a very specific way where there are diary cards, you're monitoring very specific behaviors of clients, and you're also providing phone coaching to clients in between sessions. So it's a really, it's a very full model where you're really treating all aspects of the client.
Yeah. And you said, so that's one kind of what, is there another then?
There is.
Okay.
There's more of like DBT informed treatment, which means that your therapist might be using parts of DBT, but not necessarily the full adherent treatment.
Got it.
And so this is often really useful for clients who maybe don't need that level of care where they're getting all the different modalities of DBT.
Okay.
And their therapist may or may not be part of a consultation group, but they might have been trained in DBT strategies.
Okay. So maybe that, in that way of utilizing DBT, it would be sort of a framework to inform individual work.
Yes.
Okay.
And this, in my experience, can be useful for almost everyone. Maybe not everyone needs the full adherent DBT treatment, although for certain clients that's wonderful and very, very effective. A lot of people that are in any walk of life with any kind of issue can often benefit from somebody who has that DBT-informed kind of therapy.
That makes so much sense to me. What would you say are, maybe there's not one major goal, but what would you say are some of the goals of DBT?
In general, I often tell people it is emotion regulation.
Okay.
And how to regulate your emotions and how to react and behave from this kind of regulated internal place that we often refer to in DBT as your wise mind. It's kind of that internal intuitive knowing, that authentic self that is balanced in terms of logic and facts as well as emotions.
Yeah.
And so reacting and making choices from this wise mind, from this balanced intuitive place.
Yeah, I've seen, I love that you highlight that because I've seen sort of a Venn diagram of emotion mind and logic mind, and wise mind is the intersection.
Yes.
Wise mind is that overlay of an awareness of what's going on in how we feel, while also being able to sequence that, think through it, respond thoughtfully, and if we could all be in wise mind.
I know, exactly, all the time. Wouldn't that be wonderful?
Yeah. So you mentioned a couple of minutes ago who it's, well, maybe it was initially meant to treat, but who would you say it's helpful for?
I think at this point, whenever I talk to people about DBT, it's anyone who's having difficulty with an awareness of what they're experiencing or what they're feeling. So if you have difficulty identifying your emotions, if you have difficulty even identifying maybe issues around identity or beliefs or values, DBT often works on that awareness piece. So being very mindful and aware of what your goals are in your life, what you want, and also how you're feeling. And then also what is going to be an effective way to move toward your goals. And especially when you're having a lot of big emotions that seem to be getting in the way of those, DBT can definitely help with all of that.
Yeah, so I hear you saying if maybe a listener, someone's on a scale of 1 to 10, if you find that you are experiencing a really intense emotion, maybe a 9 or a 10, and you're wondering, how did I get here?
Yes.
How did this end up this way? That DBT helps you figure out, maybe backtracking, walking that back, developing an insight of not only what got to the 9, but maybe what would it look like at a 6 or a 5, and then what do you do about it?
Exactly. And I love the fact that you brought up the idea of insight, because it really is. It's a very behavioral therapy, but it also provides a lot of insight. And the idea is that the client has enough insight that they become really their own best therapist, we often say. That the goal is for them to understand their behaviors, understand how their mind works, understand what their goals are, effectively enough that they can leave therapy and be able to understand and make really good decisions and feel really regulated in their lives.
And notice the changes and probably the relational impact that has from not having sometimes big emotions cause ruptures.
Exactly.
And noticing the absence of those things. So I've heard a lot about DBT concepts, like mindfulness is part of DBT, certainly distress tolerance. And we've talked about distress tolerance on our show other times, emotion regulation, and you just brought this up. Tell us more about these and what these mean.
All of these are, when we think of DBT, people often think of the skills group, which is more like a class. And in this class, we teach different modules of skills. So it takes about 6 months to go through all of these skills once.
Long time.
And a lot of clients are in groups for a year or more, because we teach skills around mindfulness, which is now it's a word that almost everybody knows. 20 years ago, it was not when I first started this.
Right.
So it was a brand new concept, but this idea of being very aware of what's going on around you, aware of what's going on, want to have happen in your life, or what is important to you. So we talk a lot about awareness and mindfulness. We also teach a module on emotion regulation, as we talked about, different very specific skills for how to pay attention to, understand your emotion, and also regulate your emotion. So to keep it balanced, to keep it within this kind of window of tolerance.
Because distress tolerance would say, what's the lane?
Yes.
And staying in the lines of that lane.
Yes. And I often think of emotion regulation as being kind of your emotional vitamins. So things that you work on every day to stay regulated on an everyday basis. Whereas our distress tolerance module is much more about how do you, when you're in crisis, how do you not make it worse? How do you get through it? How do you tolerate it without making it worse? I sometimes talk about it's like having a root canal. When you have a root canal, there's not a whole lot you can do to make it fun and exciting and pleasurable.
Right.
But you can do some things to get through it without making the situation worse.
I love that you're saying that, because you and I have talked, even at work, we work together, about an illness model is very different from a wellness model.
Yes.
When we're sick, we aren't necessarily focused on staying well. We're focused on getting through illness.
Yes.
And what those strategies are that mitigate illness. We aren't necessarily thinking about promotion of wellness, which is something we might do in between spaces of illness.
Yes.
And so I love that in a moment of distress tolerance, it's tolerating.
Yes.
If we flip those words, it's tolerating the distress.
Exactly.
It's figuring out how to cope, exist in that moment of could be even as mild as uncomfortable to painful.
Exactly. Like, how do we tolerate it? And how do we, honestly, in some of those moments, not expect to make ourselves feel better? Because I think with distress tolerance, a big part of that is it's okay to experience the negative emotion and not feel like I need to fix it. I need to feel better. I need to, it's okay to just get through it right now.
Yep.
And then we'll work on, after you get through it, what is the next step? How can we work on feeling better?
Yeah, which is super hard to do.
I know.
Super hard to do. In the moments of distress, it's very hard to say, I'm just going to be in this space.
Yes. Yeah, this idea of mindfulness of current emotions and allowing the emotion rather than always fighting it, especially with negative emotions. I think sometimes in therapy, we as therapists even got caught up in this idea of, I need to make people feel better. I need to help them feel more joy and more happiness. And of course, we all want that. And a lot of distress tolerance teaches us that it's okay to sit in the hard things and to experience them and to be okay with that and not fight that. And we have a skill called radical acceptance as well, which doesn't mean I'm okay with it, but it means I'm acknowledging what is right now.
I'm acknowledging what is.
Yeah.
Yes. And so you've mentioned a few different times emotions, they can impact our choices and decisions. How would you say they do that?
I think for all of us, when we are in what we call emotion mind in DBT, which is when we're feeling a really strong emotion, we're seeing the whole world through the lens of that emotion. So it's really, I mean, you think of this when you're really angry, everything makes you, you can think of all the times when things have made you angry and the person that cuts you off in traffic and how dare they? And it's kind of like you think of all the other times you've ever been angry. So it colors your whole world. It colors your outlook on life. And so our strong emotions can sometimes create this reality for us. And I think what we often do in DBT is come back to, what am I experiencing? How am I feeling this in my body? How is it showing up? And is this effective for me right now? A lot of times we use the word effective. I talked about that this morning in the group I was doing a lot. This idea of, is this working for me? Is this what I want? Is this helping with my goal in this moment?
Yeah. And is it something that aligns with my underlying value system, my beliefs about me, my beliefs of the world? Is this congruent with that?
Right.
And if it isn't,
then do I need to make a change?
Yeah, what do I do about that? How do I respond to that?
Yes. Or do I allow it? Do I allow it? There's always the option of allowing that emotion.
Yeah.
And then maybe not needing to react to it or act on it, but acknowledging it as well. So that's a big part of it. That's that dialectic that we're talking about in dialectical therapy. How much do we change? How much do we accept? Where are we on that dialectic? We always have a choice.
I totally love that. So you have kind of alluded to strategies that people can use to manage emotions. Are there DBT strategies that anybody could use?
Yes. DBT strategies are honestly, it's a wonderful therapy because it's packaged in a very specific way for us to be able to teach our clients and for ourselves as therapists. As a therapist, I use these skills all the time. To go out
Yourself,
and use them.
You use them.
Oh, constantly. I'm using them right now to do this podcast. Yes. And so DBT skills are packaged in a way that you can go out and use them yourself. They're not new skills. They're not new in terms of they're skills that have been around forever.
Okay.
So all of the listeners are already using these skills. When we distract ourselves when we're having a hard time, that is a DBT skill. When we are acknowledging that we're feeling sad and we're expressing that to somebody, that's a DBT skill. When we're calling a friend, that is a DBT skill. Sure. So we're already using them. What this treatment does is it gives us more tools for our toolbox, and it helps us acknowledge when to give ourselves credit. Like, this is a skill I'm using.
Yeah, well, I hear in what you're saying that it brings an intentionality to in utilizing what I'm doing right now. I actually made a choice.
Yes.
This didn't just occur.
Right.
That's a tool by itself, what I'm doing right now.
It's very empowering.
It's what a framing of that I have a space of power in this moment to actively engage in this moment.
Exactly. I feel like this therapy has been so empowering for people.
Completely see that.
To be able to decide, like, this is how I feel. How do I want to move forward? What are my options?
So would you be willing to tell us a strategy?
Yes. And it's interesting. I know
it sounds like listeners are already doing it.
Yes, but, you're already doing it. Let me give you a few more options and ideas, because there are so many strategies. And as I was thinking about strategies to share, I went through so many in my mind. So if people are interested in this, I would really encourage you to just go online and look at the different strategies, because there are so many. The one I was thinking of was this, and we haven't talked about interpersonal effectiveness, but that's also a a module in DBT of how can I be really effective, as we talked about that word effective, how can I do what works in my interpersonal interactions with people?
Yeah, so that would be, listeners, interpersonal is relationships.
Yes.
Any interaction that you have with another human being, that is interpersonal. And of course, emotions for all of us impact every single one of those interactions.
Exactly.
Every one of them.
Exactly. And when we talk about interpersonal interactions, one skill that I want to share is the idea of validation. And this is, I've had people talk to me about this being like a low-level superpower, one of my clients said once.
Okay,
because
I love that.
It's this idea of when you are with someone else and they are very upset and dysregulated, one of the things we can do is validate their emotions. And validating their emotions, I have a phrase that I like to use that I call the magic validation statement. And what this is saying to someone else, it makes sense to me that you feel, and then you fill in the blank. Because blank. And so it's kind of like old-time Mad Libs, but you put an emotion word for what you believe that they might be feeling. It makes sense to me that you're feeling frustrated because I didn't pick you up on time. And that in itself, that validation, and if you're not sure how to validate, what you're doing is you're saying you understand the other person's perspective.
Yeah.
That will, in itself, calm the other person down often enough that you can continue your conversation. So that is an interpersonal effectiveness skill that I teach to, honestly, I've taught to therapists in the past, I've taught to like peer counselors, and I talk to my clients about when they're in a conversation, how can they validate the other person's perspective as a way to help the other person regulate and how to keep that relationship really positive and strong.
Yeah, because, well, as we've talked about on the show many times, that we need to validate before we perspective offer, that we have to validate an emotion in order to come to an interaction.
Yes.
And we want to feel seen before we feel talked to.
Yes.
So validation does not necessarily mean agreement.
No.
One could say it makes sense to me that you feel blank because of blank. That doesn't mean you say, I agree with you.
No.
But that does allow the person who is in a space of emotion to say, okay, you get my emotion.
Yes. Yes, you get my emotion, you get where I'm coming from, and what that does is often strengthen the relationship and allows the space to have the discussion versus what happens when we're in emotion mind. We often are very stuck in our own perspective.
Well, and I love that what you're saying in terms of the strategy, we can do this for ourselves.
Exactly.
If we find ourselves sitting at your desk or in your car or you're at home and you're noticing an emotion, notice it first.
Yes.
I guess that would be another skill. That's
Yes.
another strategy. Notice it, but you can say to yourself,
Yes.
it makes sense that you would feel blank because blank. I can see why that's sort of magic because us even offering that sense of witness to ourselves
Exactly.
by itself is settling.
And I love that you brought that up because that was going to be my next point, is that validation also can be used for yourself. That self-validation, that recognizing your own emotion and why that emotion makes sense can be very, that in itself is a very strong emotion regulation strategy because you're saying to yourself, of course I feel this way. This makes sense.
Yeah.
Because that fighting it, that feeling like, what is wrong with me? I shouldn't be feeling that way, this way. That is often very dysregulating. That is what creates more emotion dysregulation.
And that's a critical question.
Yes.
In the therapy world, we're often told don't start questions with why, because they are sort of judgment-oriented questions. But then we're sort of in a power struggle with ourselves of are we allowed to feel that way?
Yes.
Well, we do. We just do. That is what the moment is. That leads me to my next question for you. Are there ways that we all could be more aware of the emotions we're even having?
Yes. Definitely. I think part of emotion regulation is being able to identify emotions that we're feeling. And to do that is often really difficult. Like, what am I feeling? And especially for people who have had difficulty regulating their emotions. Maybe they grew up in households where they weren't taught about emotions, or they were invalidated for their feelings.
Sure.
They often don't know. We often don't know how to feel our emotions. One of the ways we can do that is by checking in with our bodies and recognizing, where am I feeling this? Where am I feeling it in my body? What is the urge that I'm having? Because there are very strong emotions associated with different urges. If I feel like lying in bed all day, what emotion is associated with that versus if I feel like running away or escaping?
Yep.
So that can give us a clue to a type of an emotion we're experiencing.
That makes total sense to me.
And we spend a lot of time doing that mindfulness of, what am I feeling? What am I thinking? What urges do I have?
Yeah.
And those can lead us back to identifying an emotion and being able to name it. And just being able to name an emotion is very validating for ourselves, for other people.
For sure. And lots of us thought that mindfulness, or what we were sort of told about mindfulness, is it's this kind of Zen-like place that we are not having any thoughts at all. Now, that is one aspect of mindfulness, but what you're referring to, I love that you're highlighting this, what you're referring to is this noting of what's current.
Yes.
Just right now.
Yes.
Mindfulness is this present-centeredness in the exact current moment without a judgment.
Yes.
And being able to say, well, here, what do I feel? I feel like I want to run away right now, as you said, or I feel like I want to lay in bed all day. And using that word urge, that would be a note of then, well, let's walk that through.
Exactly.
What's the feeling that is attached to that? It's very hard for us to do anything about something we don't know.
Yes.
Is even going on. So as old coworker of mine talked about in business metrics, we can't measure we can't manage what we don't measure.
Yes.
Well, that does connect to the sort of interpersonal or emotional piece too, that what we can't name, we don't even know is a thing.
No, I know.
And we can't respond to.
It's true. That's why mindfulness is kind of the core. In this treatment, mindfulness and awareness is really a basis for almost everything else we do. Mm-hmm. And so that is something that we always start all of our group sessions with different mindfulness exercise. And I often tell people, it's great when mindfulness is relaxing and it feels really good. I love that. And we all love that. But sometimes mindfulness is very uncomfortable.
I hear.
Yes.
I definitely feel that.
Yes.
And it has me thinking about, because sometimes the moment and being mindful, we're in an unpleasant moment.
Exactly.
So noting that, and I think about really strong emotions that might be in those moments. And sometimes really strong emotions or really intense emotions, you sort of mentioned this earlier in the show, they can lead to self-destructive behaviors.
Yes.
And I think anybody listening, me too, today I can think about how I have, from a space of big emotion, done something or made a decision that has been incongruent with what I believe or who I believe myself to be, what I like to do. It definitely has shown up in a self-destructive way. What are things that people could do to avoid this, or how does DBT help with this?
Yes, I think, it starts with the mindfulness, being aware of what you tend to do individually that might not be helpful to you, that you're using to cope with emotions. And we, like you had mentioned, we all have this, whether it be, I always joke, like I ate the whole box of cookies.
Yeah.
When I got home from work and I was under a lot of stress, like that might be a way I'm coping with emotions. When you're aware of that, and it can be something more dangerous or difficult.
Sure.
It can be eating disorder behavior or chemical use. It can be avoidance.
Yep.
And it can be something like self-injury or suicide even. So all of those function from the same place of using something that's not necessarily super helpful long-term to cope with a difficult emotion. In DBT, one of the things another skill I wanted to highlight was called the tip skill. And it's about tipping your emotions. It's about how we manage really strong emotions. And it stands for temperature, intense exercise, paced breathing, and progressive muscle relaxation. The skill I wanted to highlight, and this is the skill I use a lot with people who are in crisis, is the cold water exercise.
Oh.
which is it's been researched and shown that if you put your face into this is lovely, a bowl of cold ice water.
Oh, wow.
I know.
Yeah,
I know.
a shocker.
For 30 seconds.
Okay.
You will create the dive response. All the blood will rush from your extremities into your core, and you will begin to relax.
Interesting.
This is a very effective skill if you're feeling a lot of distress. So if I'm coaching someone who's in crisis, I often will say, can you put your face in a bowl of cold ice water? Now, if they say, no, that's ridiculous, I can't do that, you can also use an ice pack or a cold washcloth to put it over your eyes, hold your breath, bend over like you're diving into cold water, and that will stimulate your parasympathetic nervous system and you'll begin to relax. This is also good if you're at work and you can't stop crying, or if you're under a lot of stress at work.
Yes.
Go to the bathroom, maybe take some deep breaths, and put some cold water over your eyes.
Yeah,
as a way to stimulate that.
Yeah,
response.
I'm just thinking about places that we might have to say, I gotta wrap this up, or I gotta zip this up. I need to fairly quickly be able to seek some regulation, because right now I am dysregulated. And of course, DBT as a therapy, if someone were participating in this long term, would be able to figure out the nuances of what leads me to that.
Yes.
Are there patterns to when I end up arriving in that moment? But for our listeners, if you find yourself there, that's a great strategy to try. That makes me think about, so if somebody's sitting there listening, how might they know if DBT could be helpful for them?
Well, I think this is something that if you're interested in this, there's a lot of resources out there. So you could start looking online. You could start looking at books about it. If you're seeing a therapist already, talk to them about it. Chances are your therapist knows.
Great point.
A lot about DBT already. It's being taught in schools, and a lot of therapists have a lot of knowledge about it already, and they could help you with it. If you're interested in more intense DBT therapy, look for a program that's adherent. You can look for a program where they do provide the skills coaching after hours, that they do have the skills group, and you have an individual DBT therapist. So there's a lot of ways you can start to implement this into your life in small ways, even with self-study, with your therapist, or in an actual DBT adherent program.
Yeah, those are such great points. I was just recently on Amazon for something else, but there's so many workbooks that people can buy that are almost kind of guided journaling around developing a sense of awareness of emotion, using some of the DBT skills. DBT loves acronyms.
Yes.
They love acronyms. The tip is even an effort.
Skill is exactly.
But how to integrate that into daily life experiences via someone maybe answering a series of questions that is that self-guided. So a pretty easy platform would be looking online for either a workbook, a book. There's some great websites.
Yes.
That people's businesses are, I'm going to put something out on a blog, or all the way to integrating it into current therapy. And I have known so many people who have gone through DBT programs, both adherent and non-adherent programs, because there are some that sort of take a group approach but don't do the individual approach, or that have said, I learned so much about myself. It harkens back to what the person in the group said, if everybody knew this, how much it would change our world. That there's part of me that wants to say, if you're already thinking, could it be helpful for you? It already will be. I have massive bias that DBT as a framework or an ideology is helpful for all people, because it helps us. We all have emotions, and we exist in a context of other human beings who have emotions. So there's part of me that wants to say it's helpful for everybody. But if you are already asking that, look into it.
Look into it, yes. If you're looking for some specific skills, if you're looking for specific tools that you can use on your own outside of the therapy session, this is a definite great place to start. The tools are packaged in a very accessible way.
And I would guess then you'd say, Kristen, that the time commitment is different than depending on those varying modalities or varying ways of doing it. If self-study is going to be a different time commitment than an adherent program. But you mentioned something that was maybe several months, up to a year. Is that
yes,
is that accurate? Okay.
Yeah. If you're in an adherent program, you people are usually in it for a year, sometimes even longer. I've had clients who are in and out of adherent programs. Now, these are people who have really significant, usually trauma histories and difficult backgrounds and difficult to treat symptoms. And they've been in and out of DBT programs for years, and they've said that it's changed their lives. A lot of people have said they wouldn't be here if it wasn't for DBT. So it can treat that, but it also can help people who are just struggling with, how do I regulate my emotions when I get so upset I can't think straight, or when I can't manage my difficult work situation, or my children, or my boss, and I use those same strategies in different ways with all kinds of disorders.
I was just having a conversation with someone about that very thing, on noticing that when they get escalated, an intense emotion, they end up saying all sorts of things they really don't mean.
Yes.
And have to, or feel like they have to, apologize a lot. And so they spend a lot of time coming back, and truly they feel sorry. But there's a lot of time spent in that, in feeling guilty, feeling shame about being mean, and wanting some insight about that, because there is a relational consequence.
Yes, definitely. And that's why we have the interpersonal effectiveness component of this, because a lot of times people have, lost a lot of people in their lives and damaged a lot of relationships because they reacted from that emotion place, and there was no there was no time between the urge and the response. And so a lot of what we're trying to do with mindfulness and with skills is trying to increase the time between the urge and the response, and help people have that insight into, I'm having this emotion, I'm having this urge, I'm having this feeling. How do I want to respond? How do I want to respond short term? How do I want to respond long term? What are my goals for this relationship?
Yeah.
So it creates a lot of mindfulness, and trying to implement mindfulness of the situation in the moment, which is very challenging for all of us when we're feeling strong emotions.
Yeah. And when we are feeling intensely, those are usually very activating times. So it tells us an immediacy. Yes. The immediacy needs to happen. We're like, right now. Right?
I need to feel better now. I need to do something about this now.
Yes. And that learning that ability to pause.
Yes.
To slow down. Tara and I have talked about that many times on this show, that even giving ourselves sometimes seconds to take some breaths makes a difference in how we would respond. But it helps us even know what is going on. When there's such a tiny window between urge and response, we don't necessarily know even what was going on until after it's already done.
And sometimes you get people say, I don't know what happened.
Yeah.
Because they were so emotional and it happened so quickly.
Yeah.
And I also want to highlight something else based on what you said, is that guilt and blame. Part of DBT is also a lot of validation by the therapist, if you're working with a therapist, to say it makes sense. Again, it makes sense that you reacted the way you did based on what you were feeling, based on what you knew. Of course.
Yeah.
And what can we do differently, or how can we make this different next time?
Right. There's nothing in that statement. I love the example there, because there's nothing in that statement that says that it's okay what happened.
No.
In fact, everybody in the space might agree.
No.
But to say that feeling makes total sense based on what that moment was.
On what that moment was. And the feeling, in my experience, the emotion always makes sense. If you look for it carefully, the emotion always makes sense. It doesn't necessarily mean that you wanted to react the way you did.
Yeah, the action might not have been congruent with what you would have picked in a space of wise mind, as you've been talking about. But the feeling, the feeling gets to make sense. We don't practice this enough.
I know, with ourselves, with others.
Yes, we look for, was my action okay?
Yes.
And then we sort of judge that action. And I'm right along with people in the guilt and shame that we feel from those decisions. So I'm like, I do not love that I did that. And then we stay there in the judgment, rather than saying, going back to the root of that would be a sense of compassion, as we've talked about, validation for the emotion.
Of course.
And also saying that there maybe was more than one choice.
Yes.
We picked that. We decided that one thing. Are there other options?
Yes.
There's so much to think about here. This has been such a cool conversation. We're headed to a commercial break right now, but when we come back, we're going to talk through listener questions all about dialectical behavioral therapy. Feels Out Loud will process these questions and all of your thoughts in just a moment.
Danger, trying to find what you lost. You can't go it alone. Everybody needs help.
We are back again with Feels Out Loud, and this part of the show is where we talk through questions from you all, our listeners. If you have a question related to mental wellness, sharing feelings, or topics for each week that you would like us to process through, please visit our website at becomingtogethermn.com and find the Feels Out Loud page to submit a question directly. Email us at contact@becomingtogethermn.com, or of course, follow us on social media. We really want to hear from you all and what you're wondering about. And a giant thank you to the people who have sent in questions about DBT. Kristen, we had a bunch of people who have experienced this before, who have utilized the skills, people who knew nothing about it. So it was a very broad spectrum. I think we learned we need to do more shows about DBT. And we just tapped the surface on... There are so many skills, there are so many concepts, there's themes, and I think you and I would say, well, we all benefit from knowing more. So 2 questions from our listeners today, though. One said, how can I incorporate grounding skills in my daily life? So this is a person who clearly knows a little bit about DBT includes grounding skills. What would you say?
Well, when we think about grounding skills, I think when we think grounding, we think, how do I stay kind of regulated? How do I stay focused? And I have lots of different ideas for how you could do this. One of the things is just to be able to identify, like, where am I today in terms of my emotions? How am I feeling? And then what is asking yourself on a regular basis, what would be effective for me in this moment? So coming back to the current moment, I love this word effective.
Yeah.
It's not what's right or wrong or what should or I shouldn't be doing, which is often what people question. It's what is going to be effective. And in order to think about what's effective in each moment, we might have to ask ourselves, what do I want the outcome to look like?
Yeah, what would be the goal?
Yes, what is the goal?
Of the day or the moment?
Of the moment, of this hour. And that can often help ground us when we're feeling overwhelmed, when we're feeling like there's too many things, there's too many problems, I can't solve all the problems. I often come back to, okay, right now or in the next hour, what is going to be an effective way of getting into this moment? What do you need to do? And then getting fairly specifically concrete. I often think, like, I'm going to eat my breakfast. I am going to, I'm going to get out of bed. I'm going to take a shower. And I'm going to notice what it feels like to take a shower, what the temperature of the water is, what the smell of my soap is. So getting very, very detailed and specific and concrete.
Because then from that, we have now named the thing that is easier for us to also measure. We can say we did or didn't do those things. So I really like how you're saying also that word effective allows the answer to change from moment to moment. What might be effective in the morning might be totally different in the evening even.
Totally different.
And people can think about what would be effective right now. To eat breakfast is really different from to put on pajamas.
Exactly.
And so to walk through and give yourself permission to say what will be effective right now for me to do requires that awareness of self and then a response with very specific details. And leads me super quickly to the second question of, it's really hard for me to be kind to myself when I'm experiencing intense feels. What can I try? And in a couple words, what would you say?
I think being non-judgmental toward yourself, recognizing that your feelings have a cause. And again, back to like, it makes sense that you're feeling the way you do and that there's not, and then back to this idea of there's not a right and wrong, but what is effective? What's an effective next step if you need that?
That's, I absolutely love that you tied in what we talked about the entire last segment, that to this listener, practice those.
Yes.
Validate for yourself first.
Yes.
Validate for yourself first. Wow. We're at the end of our show already for today.
Oh.
Thank you for listening this morning, and thank you for coming on today, Kristen. Join us next week, everyone, as we talk about supporting young adults and what this stage of life needs in really getting through the moments and supporting mental wellness. And in the week ahead, be kind to yourself, everyone. Remember, connection fosters wellness. And your voice is one that the world around you needs to hear. Share yourselves, friends.
Some do, some don't, some will, some won't. I wanna feel just a little